Now, Basic Education Minister Angie Motshekga says COVID-19 protocols will remain in place as inland pupils head back to school from this morning. The fourth wave has been dominated by the Omicron variant, which is a more transmissible but less harmful variant. But with hundreds of schools opening this morning and children younger than 12 years unvaccinated, how much of a threat is the Omicron variant to public health? Let's break down this for you now. Health of Infectious Diseases at the University of Pretoria is Professor Veronica Ueckermann, who joins us now via our video link. And Prof, thanks for making time. Great to see you so early in the morning. And, you know, I guess for many parents who are still anxious about sending their pupils or their children back to school today, part of the questions they'll be asking themselves is the time right? Is where we are with the pandemic conducive for contact learning?
Good morning to you and your viewers. So as you mentioned before, we're at a stage of the pandemic where we've got a variant which is very transmissible. And so that does complicate things at the moment. However, we are seeing that it's causing less severe disease. I think the idea of carrying on with rotational learning is absolutely necessary. And it's very important for us not to become complacent in terms of the usual regulations. But at some time, I think it's important to balance the risk and the benefit in terms of health and the education of our children. So if this is managed in a proper way with the proper regulations, we should be all right going forward. And I was very relieved to hear that there is still rotational learning going forward.
Yeah. And how much do we know about how effective rotational learning actually is, especially when you consider the cost that it comes with, costs to at least covering the syllabus?
Yes, certainly. So if you look at the transmissibility of Omicron specifically at the moment, I mean, managing numbers would be critical in this setting. I'm not an educational specialist, so I can't really comment about the effectivity of rotational learning, but there should at least be some contact, I think, especially in our lower grades and our more important grades. The kids have had a very difficult time. We know there's a lot of inequity in accessing in terms of internet access, etc. So I think it's important for kids to be able to resume, but again, with the proper precautions in place. I think that we just need to manage this now. We need to balance the two out. Yeah.
Managing, of course, will come in a context where we're empowered with knowledge. How much do we know about how Omicron responds, especially to children?
Yes, so we were very frightened at the beginning of the pandemic to see that there was an increased number of children compared to the other waves. We have since learned, however, that mostly this was a coincidental finding. So lots of kids were coming to hospital for other reasons and were testing positive, and that really drove the numbers. However, we do know that Omicron is transmissible. We do know that kids can get it. And of course, we do have vulnerable children that we also need to protect. And again, that comes back to what we're doing to protect ourselves and our community in terms of vaccination, in terms of masking, in terms of sanitization and social distancing. It becomes very important. So the kids aren't getting as ill. They can also be asymptomatic carriers. And of course, we have to remember that the school system is not just children. There are older teachers, other workers also involved. So it's very important that we do continue to protect each other.
Yeah. There's obviously going to be a whole lot more questions about what we're doing to try and ensure that children are inoculated against COVID-19. Last I checked, the South African Health Products Regulatory Authority had given the go-ahead for at least one Pfizer shot in a context of booster shots taking place. Do you envision that dosage, for lack of a better term, increasing?
I think so, yes. I think we will be seeing boosting, and we have seen, worldwide boosting occurring even in this age group. And, in the over 12, there is now an option for a second Pfizer shot. Hopefully, we'll be seeing the younger kids also being able to vaccinate pretty soon because, the data is emerging that is safe in children over 5. So definitely boosters will become available. Yeah.
And again, COVID-19 still feels largely like an unpredictable virus. However, there's already talk of us living with the virus. And I wonder whether you're getting a sense that we're approaching that point, especially because of what the NICD has also announced yesterday, in part, that the country will be out of the fourth wave in a matter of days.
This is what we're hoping for. We're hoping to see COVID-19 become endemic. It's often likened to seasonal influenza, that it's something we coexist with, but it doesn't cause the kind of chaos in the health system and, of course, the kind of mortality and disease that we have been seeing. We are hoping and we are optimistic that we are approaching that. In fact, and Omicron might have actually helped us with that because it's very transmissible. Lots of people are getting the virus and getting some immunity. However, they're not getting as ill necessarily. And always, there are still those who are getting ill, so we shouldn't underestimate it in any way. But we are heading towards that. Certainly this wave was a much better, a much easier wave for us as healthcare workers than the third wave was. So we are optimistic that we're heading in that direction. Yeah. Again, no room for complacency.
Absolutely, absolutely. Those non-pharmaceutical interventions for now are here to stay. Interesting you mentioned that Omicron is actually helping us approach, call it the end of the pandemic, dare I say. What is it exactly about Omicron itself that is giving experts like yourselves the kind of optimism you're expressing? Because what I'd heard in the past is, terms such as exit variants, for instance, in any pandemic. Is that what Omicron is?
When it comes to COVID-19, it's proven us wrong many times, but that is exactly what we're hoping for. So the idea that you have something that causes less severe disease, is highly transmissible, and that especially in countries like South Africa, where our vaccination rates aren't as high as we'd hope to get to, what we eventually would like to see as some sort of herd immunity, then, at least we're getting some natural immunity going. We don't know. With SARS-CoV-2, there could be a new variant, but we are really positive about the trend that is going on in terms of comparing Delta to Omicron, and we know that Omicron has now surpassed Delta.
Absolutely. Thanks so much for breaking these things down for us, especially for those who still have those last-minute questions just hours before the first bell rings for the academic year in 2022. Professor Veronica Ueckermann is with the University of Pretoria. She's the head of infectious diseases there. Once again, Prof, thanks very much indeed.